The baseline survey was conducted between July and August 2018. It capitalized on finding out the prevalence of malaria parasites and anemia for children under 5, incidence of malaria, health-seeking behavior and uptake of services for mothers, caretakers and under 5s.
Malaria transmission is not uniform all over the country. That area actually has disproportionately higher malaria. It cannot align to the national average because the national average is brought down by areas like Kampala.
8,280 households were reached, with close to 12,000 women and children contacted in the Lango, Teso and Karamoja sub-regions. The study shows that 55 of every 100 people contacted in Karamoja have asymptomatic malaria, followed by 26 in every 100 people in Acholi, and 16 people per every 100 in Lango have asymptomatic malaria.
A situation where someone has got the malaria parasite but has not yet developed the malaria disease. You have especially adults who have immunity to malaria. They can remain asymptomatic. They infect mosquitoes. Mosquitoes infect the children.
This has led to the high prevalence of malaria parasitemia. Malaria parasitemia refers to the presence of malaria parasites in one's blood. The study shows that 36 of every 100 children tested in Karamoja had malaria parasites in their blood, while in Acholi, 10 of every 100 children were positive. In Lango, it was 7 of every 100 children with malaria parasites. The Ministry of Health says this is why the region still ranks high in malaria prevalence.
The Acholi and Lango region is at the moment at over 28%, which is quite very high. The national is at 19%.
The ministry is hopeful that the global malaria targets can be achieved by the 2030 deadline. However, they agree to the fact that there are a number of challenges along the way.
There has been shortages of medicines at the VHT level, especially in the north, because of the information which was used for determining the need.
In 2015, the northern region registered an upsurge of malaria where up to 60,000 cases were registered per week. Uganda is still among the top 10 global contributors of malaria cases and deaths registered annually. MWESIGYE, NTV.